Episode 87 of People I Know show. Curt Carstensen joined by Dee Fiel today from somewhere in Alberta, Canada, I think. I'm not sure. You're my Canadian nurse friend. And we're going to have a conversation today about my recent COVID. Hi, Dee.
Hi, Curt. How are you?
I'm doing well. I'm fully healthy now, which is excellent. I know I know that when I told you about having COVID, you had lots of questions and concern. And I
Mhm.
do know that you have been working for many months involved with the disease and learning about it and with patients. I'm curious your background and experience so far since March. Now it's late in the year. What have you been doing precisely and how much have you learned?
A lot. We follow directions here in Alberta. We follow directions from our Ministry of Health, and it changes a lot. Like in the beginning, masking was not mandatory, and then you see it like happen overnight, like masking. And then I work for a care home, and the visitations were stopped, and a lot of things happened since March until now. Visitations are back, and it's very interesting because um, they've asked staff to be um, reporting symptoms almost twice a day. And we also check our patients twice a day for any type of symptoms. And we have a long list of potential symptoms. And if you have at least one, then you will have to stay home or get tested.
So it sounds like it's fairly common where someone's going to have one of these symptoms because these symptoms can be associated with lots of different issues.
Exactly. And sometimes we joke about like if you sneeze and fart, you'll get tested. So everybody gets sneezes and farts. So they get tested almost, yeah, every day. But here in Canada, the government pays for our testing and you book it through them online.
Yeah, I think the free testing has become much more commonplace in the United States. I ended up getting tested through the clinic at my workplace, but I had signed up for a free test elsewhere by the Minnesota Department of Health, and it seemed fairly prevalent. There's still some places where I could have paid on my own, but of course I avoided those and was looking for a free way to get a test because at that point before I got tested, I didn't know that I had it, and I didn't really want to spend my own money. I wanted to keep other people safe, and I feel like that is the responsibility of the supervising government to make sure people feel good to go get tested and not have any restrictions for it.
So did you like follow work guidelines that if you have one, at least one or two of the symptoms, you'll go for testing, or did you just go on your own?
The symptoms really hit me over my weekend. So initially I was looking to get tested during the weekend before I would go back to work. And I ended up getting tested through my workplace because I decided my symptoms existed, and I called in and said I wasn't coming to work, which is what we're supposed to do. I think if it was a year or two ago, I would have gone to work because I, like a lot of people, if I feel a little sick, but not so sick, I don't feel like I should just skip work. I have the mentality of showing up to the things I'm responsible to show up for. And that's what I would have done. But this year I thought, okay, they're taking a lot of extra care and I understand why. And I agree with it.
Mhm.
I reluctantly will say I'm not coming into work because I have symptoms. And then the process started where it led to me going through an additional screening and going in for a test.
Oh, is this your first flu or colds? Have you had colds and flu before?
I've definitely have colds and flus most years of the past, but I hadn't felt sick in like since the pandemic began. I don't recall ever really thinking I might have it based on any symptoms I had. So I'd been healthy for many months. And so then when the first initial symptoms started to come on, it's a thought of, do I have it? Could I have it? By what's the criteria out of when I don't feel quite normal? Should I change all my behavior and assume that I might have it? And that's a difficult space that I realize a lot of people or everyone probably goes through that in some way if they're concerned about not spreading it, but also there's so many symptoms that we might have for other reasons that have nothing to do with COVID. The unknown, and unknowns are so important to try to try to manage. I don't know if I have it. I could have it. What do I do differently right now? And I went through that, and I imagine so many people are.
Yeah, because like you don't know, right? Like some of my friends are asymptomatic, and the wife tested positive, and so they were proactive and went to get the test and tested negative on the first swab, and then had a headache in like 3 days after, and they insisted to get another swab and tested positive. So like sometimes it's like UTI like symptoms, like back pain, or like here we have on our list even like like red eye is one of the like something like that. It was listed as one of the symptoms that you should be aware of, and even at some places even like mental health changes. So that was like non-respiratory, and then you will have to go for a test. So that was really interesting. Like, so yeah.
That you're saying that's the official Canadian or Alberta list of possible symptoms that are related to COVID?
Well, for Alberta, we have the typical flu-like symptoms, but some workplaces, they would require you, if you're not feeling well, uh, like like the eyes, and also the mental change in mental status. So I've known like some places they in the beginning, but the government put a stop to that because a lot of like workplaces became too cautious, and every little thing they would like go for testing, and the government put a stop to that and put like guidelines of symptoms that you can go for. And now they've limited that with possible exposure. And if you don't have any possible exposure, and contact tracing, if you did expose yourself, like mask, if you wore a mask and the people around you wore a mask in while social distancing, then that should be fine, and they won't even like encourage you to get tested. But still, you can insist and say, look, I'm not feeling well, and yeah, so they'll still test you.
Yeah, I think there's been a lot of adjustments with initial policies for that. I know like 15 minutes seems to be something that's used, at least in some places here, where if the exposure was less than 15 minutes, it's not as big of a concern. It's somewhat about being exposed, but also having enough time for there to be a likelihood that you can contract the virus, because a brief exposure to someone that is shedding virus apparently then still isn't that likely that someone else would get it. It takes some time being around someone and to be breathing that same air.
Yeah, initially, I think it was like May, around April and May, we were able to control the curve, and suddenly all these people were returning back to work, and people were not social distancing during break times, so they weren't wearing masks. And so we've seen like outbreaks at like food processing plants, and recently also in hospitals and care facilities, because healthcare workers weren't masking during break times. So that was a concern as well, like people not following instructions of um, wearing masks or social distancing, sharing food. I think that was another, um, like we still see it now, like gatherings, like there was like a wedding that happened, I think last month, and that was a super spreader, and things like that. And just people not following social distancing and not following like masking. So far, we've managed to keep our numbers down. People listen here in Alberta, but I think people are just super tired as well from wearing masks. I mean, I don't like it. Like for a healthcare professional, we have to wear it the entire time and replace it when it gets moist in every 3 hours. So it's really constricting, and I can see why people who are not who are non-medical don't really follow it, and it's sad because um it can get into like a care home, and in the general public, like schools and processing plants, it wasn't, there were no deaths, but when it comes to like care homes, like if it gets in there, that's where you see a lot of old folks really die.
Hmm.
But interesting enough though, like some old folks also recover from it. And I've like as a nurse, I've seen influenza A and B, and then SARS and other types of viruses back then, and it's about the same. Like I see that people recover from it, and people also die from it. So I'm not too sure yet with the numbers if like mortality rate, like is this worse than influenza A and B?
Do you sense it's the same type of people with the same type of vulnerabilities that are vulnerable to this, or might it be somehow different in some way that we're learning?
It's behaving the same way. Like it is behaving the same way. Old people. The thing is, though, with influenza A and B and most viruses, we have vaccines, and this is my take on it. It's like we have preventive vaccines every year. By September, we always get vaccines that are selected ones from one from China, one from Australia, the virus strain, and then it would sometimes be 3 or 4 valent vaccines given every year. So I think that kind of help prevent deaths and illness in most long-term care places or with the elderly, but nobody prepared for COVID. But I can see people die from simple viruses too, because their body's just not able to fight it or endure, because it's just a couple of days that your body has just to endure that. Otherwise, if you can't endure the first 5 days or the first 3 days, you really will succumb to yeah.
It's kind of the difference if your body can, as I like to say, turn the corner, like get it under control. But if you
Mhm.
can't get it under control, it just keeps going downhill, I suppose.
Yeah, yeah. It's behaving very similar to the viruses, and we also have viruses that are common that that would show symptoms, like even though you're asymptomatic, even though the virus has already left your body, like you're still seeing coughing and sneezing for the next 21 days is still normal. So I flew one time to South America, and I was coughing and I was coughing for like almost good 3 months there until it totally stopped. But then the virus was already gone. But I don't know what kind of virus it was. But I was just like sick for 5 days, um, probably contagious for the next five, and then afterwards I wasn't able to shake off the symptoms for like 3 months. I was still coughing, and I went for an X-ray. I went for a further test, and it was all negative.
Yeah, at the end, it was right around the time I was starting to feel better is when my cough came on for COVID, and it felt like a cough that would be around for a long time, and it's not gone yet, but like the last couple of days, it's not been so bad where I feel like, okay, maybe it's actually going to be a very minor issue at best, and maybe it'll be gone very soon. And I'm only in the first, week and a half, 2 weeks of my recovery here, and I feel like the cough is gone, and maybe I have nothing, like no long term. I know there's a lot of people with the long hauler systems, as I've read about. I'm just so optimistic that I've escaped this with a couple of weeks of feeling pretty bad at times and okay at other times, and nothing long term. That's my hope. And I suppose the risk is for anyone of any age and any sort of physical ability to be stuck with some long term symptoms that really give them problems. Unfortunately, I don't think I have those.
So my family works for healthcare as well, and they, especially people at the hospitals, they've seen people never fully recover from it. Like if you have comorbidities like obesity or any other like major issues prior to COVID, they've seen recovery is very slow.
And I believe it. I guess I haven't known anyone. Well, I shouldn't say that. I had a podcast episode several months ago with a relative of mine, who kind of distant relative, or the husband of the distant relative that had it. And he was at the very early days of the pandemic, when I don't think doctors and nurses and hospitals really knew what to do. And so he was very close to dying, but he recovered, but he still has some of the long hauler symptoms. And he's kind of just sorting through that to try to get back up to 100%. But he's gone back to work, and life seems to be close to normal. But I'm curious for him and other people if they will ever recover. And it sounds like maybe not fully.
So when was that time that you realized like something was wrong, or did you still think that it was like, did you think that it was like normal and it was just because there's like COVID screening out there, so you went for screening? Or
I had about 2 days of where the thought entered my mind that it's possible maybe I have it, because I don't feel quite right, but I also felt pretty good. Like it was headaches more than anything. I had headaches maybe 3 straight days, which I don't normally get. And then I would take ibuprofen and the headache would go away and I'd feel good. So I felt good most of the day, and then would cough, the real light cough, just a couple times, like maybe 2, possibly 3 times during those days, where I noticed, okay, this is different. I don't feel sick, but these are symptoms. Like if we're supposed to watch for symptoms, they are symptoms. And that was right as I headed into my weekend from work. So I had some time off, and the Friday night, I slept, I guess, pretty normal. Woke up feeling okay. Maybe had a headache then the next day. And the Saturday night, I woke up Sunday morning and I was so achy, like my whole body ached mostly. And I knew then that, okay, I am sick with something. Whatever I was sensing the last couple of days is something bigger than what it seemed. And then that's when I started the process of figuring out when to get tested. Do I go to work? I shouldn't go to work, but like just that, though, all those thoughts really were striking me at the same time. Like, this is something, maybe it's COVID, maybe not, but I'm definitely sick with something. So
and
it's
how did you
three
get the
days.
okay, and how did you get the result?
The result, my workplace has a clinic and a rapid results system that within 30 minutes of me getting tested,
Oh
they
wow.
called me and told me I was positive, which of all the difficulties in this process, getting that answer as quickly as I did once I got tested was just the most relieving thing to know. I think sitting with that uncertainty for oftentimes 2 days. I think some people have tests that take much longer than 2 days to get back. It's like, almost, what's the point? If you don't know what's going on, how can you act properly and not like disrupt so many others' lives, maybe unnecessarily, in the meantime?
Do you have any fears when you heard COVID positive?
Not so much. I suppose there was a handful of people that I might have put at risk before I knew that I had it. There wasn't many, but fear that I might have spread it to them, which, as it turns out, I didn't. None of
Okay.
them had any symptoms. And I guess so, I assume none of them would have been positive. A couple people went to get tested, but for the most part, everyone just took extra care and no one had symptoms and no one got sick, and their window has passed. So it doesn't appear that I spread it to anybody. And fears for myself, not really. I figured most young, healthy people get through it okay, and I figured I would, and I did. It wasn't. I've been more sick in my life. I've been fairly healthy my whole life, but I've been more sick. But also, as I was going through it, it was one of the more challenging illnesses I recall. It just it kept going, and the symptoms kept changing. And
Mm.
my days where I'd feel good for a little while would end with me not feeling good. So I could see mentally how it can be really troubling. Like, it was troubling. It's like I was demoralized so many days, thinking I'm not getting over this as quickly as I'd hoped. Because I feel like in the past I would get sick with something and I'd be kind of past the worst part within a couple days. With this, I don't really know when the worst part was. I think the worst part was pretty much every day for about 10 days.
Oh, so you didn't see any peak at all, or like after 3 days, or
There's peaks with different symptoms. My body aches peaked that first day. The second day it wasn't as bad, and after that I didn't have body aches anymore. I guess one of the least favorable symptoms I had was diarrhea on a couple occasions where it came on and got better
Mm.
and then came back worse. And that was not ideal, right? Kind of towards the end where I thought I was should be getting healthier than that I had to deal with for a couple days. And I struggled to get past it. So it's not pleasant to talk about or envision, but it's even worse to deal with. So I was happy that was done, but I'd say those were the worst symptoms.
I was curious about that too, because like I've seen and know a lot of people who had COVID and diarrhea was not one of them. Like most of the complaints were the loss of sense of taste and smell.
That's
But
one I
I,
avoided. That's like the only symptom on the list of the symptoms that I found that were possible or likely that I didn't have. It's possible I had a diminished taste of or a diminished sense of smell. There's a slight chance. My friend who he and I share a place. One day, a few days ago, he had this odor that he smelled in the kitchen, like something really disgusted him, and I didn't notice it. So then I thought, well, maybe I'm not quite as sensitive right now as he is, or maybe he just is more sensitive for what other reasons to some odor. But I just had no sense of it at all. But I then would like try to smell things, and I knew I didn't have zero sense of smell, but maybe it was less.
has this been like, has this been the worst illness in your life? Or have you had like,
For something, it lasted longer with more difficulty than I think anything I've ever had to deal with. I felt worse before for sure, but for shorter amounts of time, maybe 1 or 2 days, that then I would start to feel better more quickly. But I would say this was the one that I had to deal with the longest with more uncertainty because my symptoms kept changing. It was this the kind of thought of what's next. Okay, so I've gone through these 6 symptoms over the course of 10 days. What's the next one that comes on? When does it end? Why does it keep changing? Why did I think I was getting better and then feel worse again?
I think that would be so scary for someone to like, typically, like for some common colds and flu, you'd feel better after 5 days. How long did it take you until you felt like, I'm starting to feel a little bit better?
The first day, let's see, the first day where I felt terrible was a Sunday, and it was 2 Fridays later before I went through an entire day and I thought I felt good the entire day for the first time. So it was nearly 2 weeks, but I
Mm.
started to get some minor symptoms probably the Friday before. So it was probably 2 weeks before from the onset of a symptom to where my only remaining symptom was my lingering cough. But I still felt good, but just had a cough. Whereas every other day, I felt like something just wasn't right in either half of the day or most of the day.
So like for us nurses, we typically don't like, I know for a fact that my friends and I, we never go see the doctor unless we're super, super sick. But nowadays, like if you do feel like something is wrong, you go and get tested, right? I think it's really scary to not get tested and realize that you have the virus and pass it on to other people. Um, was that like a big fear of you, like with the like older generation or people around you, that you would pass that on to them and they would like guilt trip you and like, Curt, you tested positive and
Yeah, I don't know that it was a big deal like for once I finally had it, but I know I've been living my life with that concern for many months, like knowing that people have it but don't have symptoms but can spread it, or believing that I believe that is true. And I don't know how common that is compared to someone that definitely has it and is sick spreading the virus, and how that all what's most likely to spread. But knowing that it was possible that I could have it at any time and spread it, I think that kind of weighed on me a little bit for all those months, because I do come in contact with a lot of people for different reasons, although I usually take pretty strong precautions, but maybe not always. And in those days where, okay, I knew that I had some level of some symptom that seems abnormal, And then I did, I guess, put a few people at risk. I took extra care, not like even the couple days before I knew I was sick, before I really felt that bad, I wore my mask in even additional situations than I would have in the past, just to be really careful, knowing that I don't feel like I'm sick. I don't think I should stop living my life, but just in case, I want
That,
to wear my mask.
that's very, like, I don't know, like for us Canadians, we see Americans like we still have to continue with our lives. And um, something that we noticed was the pushing of the group or herd immunity message. And we're like, wow, the Americans are really like, and sometimes I think like, are they doing the right thing by getting herd immunity, or are they being stupid for doing that? Like
I
what's
don't
your
know
take
that
about?
all Americans go about it that way, but I think in this country it's more common. And the thought that people, well, I had this thought right before I got it. I still figured pretty much everyone's going to get it anyhow. Like,
Mm,
I'm just not convinced that a vaccine, although it might work for a while, will be like a permanent solution. So then you're going to need to get a vaccine. It's kind of like the flu, get a vaccine every year in order to avoid some flu. And we do know that most viruses, and this virus appears to have mutated somewhat. So the thought of never getting it didn't seem to be realistic to me. It
mm.
isn't like I wanted to get it, but I also don't think that we shut down the world until we're sure everybody will never get it, which obviously that's not what we were doing, but it kind of feels like some people treat it that way. I was more in the middle of, okay, we can take precautions to minimize the amount of people that get it and still live our lives at least somewhat. That seemed to be the best answer for me, especially because I have a workplace where I'm around people a lot. And it's obvious to me the virus was not spreading there, has not spread there. I mean, it's possible a little bit a few times, but it's not like super spreader. And all it takes is everyone wearing masks and cleaning things effectively, and you don't get super spreader events. The
So
super spreader events are when you're around people with no masks and you're like all in the close space and touching the same things and no one's taking precautions.
do you think like people are more scared of, like right now that we're talking about the vaccine, I think, do you think that they're more scared of the vaccine more than the virus?
I don't understand. Maybe I do understand, but a part of me feels like I don't understand why people are so skeptical of vaccines. It seems like that has
I'm
grown
skeptical.
more and more.
I'm medical, but I'm skeptical of vaccines.
Well, if there's skepticism over it might not work all the time for everybody, or maybe somehow it could harm someone, I can understand that. But it's clear that vaccines have brought down some of the most ravaging diseases of our
Mhm.
knowledge are no longer causing many problems because of strong vaccination efforts. So, so what's
I'm
your
in
concern?
in the Philippines, though, we have dengue fever, and it's really common in in tropical countries where mosquitoes actually infected mosquitoes will bite children. And what dengue fever does is that it disrupts your platelet, and so the person who has it will not be able to. The clotting factor will the blood becomes really um, um, uh, thin, that if you tend to bleed to death. So dengue fever is really common in Philippines and other tropical countries, and um, it's killed a lot. I think it's killed more kids than COVID. And so I think it was like a French company that developed a vaccine, and they've given it to the kids there, and there were a lot of deaths associated and illness that were associated with it. So that was really a good wake-up call that some of these vaccines have a really bad effect on people. So we can look it up, and it was like a wake-up call for me that sometimes some of the vaccines are just like pumped so fast and not enough like research about it. So yeah, that's kind of like my fear. Like knowing for a fact that there was a class action lawsuit, because knowing that, it was just like, wow, like any vaccine can go wrong. I
So
mean, so,
yeah, I guess that's the space then where I think we agree, but I was taking it one direction and you look at it from another way, is how thoroughly have the trials been for a vaccine? How confident can we be in it? What are they using to suggest that it works? Like there's a recent one here in, I think in the United States, Pfizer and a partnership with some other company is demonstrating 90% effectiveness with this vaccine based on 55,000 people did it. And were a part of the trial. Half of them got it, half of them got like salt water or something, and they don't know. And of those people, it was way more likely to get COVID-19 if you didn't have the vaccine than if you did. So that's how they come up with this 90% effectiveness. I don't think that's enough to say it's safe. It's good to put this in your arm, but okay, it's showing something. And so I wonder with the dengue fever in the Philippines, how many people participated in trials before they ran it out and started putting in kids?
yeah.
I guess that's the question. How thorough is that? And that do we trust the companies that do it and everyone that oversees it, that they do it thoroughly and really with safety in mind? And I guess I kind of assume that they would, but maybe I shouldn't assume that, because ultimately I think a lot of these vaccines originate from someone somewhere thinking they're going to make money off of it, as opposed to making sure it works and everyone is as healthy as possible in the process.
Like, I trust vaccines. Like, I'm a strong believer that everyone needs to be, it's science and it's proven. I think it's the amount of time that they had to pump the, like, they haven't done a long-term study yet, like how it would affect like pregnancy in the future, or how it will affect your DNA. Will it mutate? Like, that's like my fear, because most of the vaccines that we have had studies and been tested for a long time. So this is such a quick vaccine that they've cut red tapes and whatnot just to get this available to the public. And I don't know. I haven't heard from China saying anything about like, oh, they're going to start like with their population, and so that they're going to start with the vaccination. So that's kind of like where I'm like, how come we haven't heard from the epicenter before? Like, what have they been doing? And um, are they advertising vaccines? So
And would they, I don't know if I guess is more of a political thing, would they even be open to talking about it that much until a certain point where like we're much more open about what we're doing in this country than some other countries might be? I think I heard Russia a month or two ago, they, without proper trials, were starting to use a vaccine. I think that was a thing. At least it hit the news saying that was going to happen. So I'd imagine countries handle things differently. And maybe with if it was a French company in the Philippines, maybe the oversight on that wasn't as strong for some reason. I don't know. I don't know how these things happen in some places, but I'd like to think that in this country, if they're going to put one of these out there, that it's been thorough, that the people that study this, that want to make sure it's done right, get their voices heard. And if they have any skepticism towards it, that it's not put out to the public until we're confident in it. And if we're confident in it, then people should take it.
are you going to take it?
Beforehand, yes. Now that I've had the virus, I will stand at the back of the line and I try to understand if people have already had the virus should take it. I don't know why I would. I mean, I've already had the vaccine by having the virus, right? Like essentially.
Well, that's interesting too, because like COVID-19, there's a lot of COVID out there, but not the 19. So I wonder, like, were you made aware of what strain of COVID you've had?
No, I thought it's always what SARS-V2 or whatever is the COVID-19. But yeah, I think you're probably right. There's a more specific thing that I'm not sure what it is.
Yeah, because there's like a lot of coronaviruses out there, and SARS is one. And and going back to the test results, like how accurate were they that it was like COVID-19 that they tested, or was it like for coronavirus that they tested? Because if it was for coronavirus, then it would test, it would just like say you're positive, and that is kind of like a conspiracy thing. Like, might as well just like, if you have a virus, just like, even if it's not COVID-19, but it's a corona type of virus, just like stay home, don't pass it on to other people. And so if it wasn't really confirmed like a COVID-19
Yeah,
virus.
I believe it. Well, I believe they at least told me COVID-19. I never saw any paperwork or anything to go with it, but I was told I had it, that tested positive for COVID-19. So then I went through the protocol.
I think there's also like a test, like to see, like I've taken like serum sample and, like to see if my titer, like for Hep B and Hep C, like for what's this, chicken pox, is still the right level of titer, just to be able to protect me if in case like I get exposed to those type of viruses. So yeah, maybe something to think about, like if you wanted to get a titer, if you really are immune to COVID-19.
Yeah, I think I'll still stay in the process and do whatever tests or vaccines in the future if I think I need to. I don't feel like I'm safe from it forever, but I also think that now that I've had it, I've got a few months where I don't need to worry about it as much as other people should, and I'll still take the precautions like I was before, but also I do feel a sense of relief to have already had it and recently had it, so that whatever mutations are going to happen are very unlikely to affect me, which means very unlikely that I can negatively affect anybody else. Is that the
I'm
right approach, or do you question that?
like, I'm scared. Like, I'm still scared of the virus. I don't want gimpy kids. Like, I don't want it to like somehow in the future, like if I do get pregnant, I would be like, oh my God, or have kids or whatever. Like, I'm like, oh my God, like, um, yeah, that's like my fear, but I think I won't have any choice as a healthcare worker, that I will have to, like, there's also a lot of shaming going on if you don't get the vaccine. Like, some communities are just like, oh, you're a professional, you should like, but I like, yeah, and I hate that portion in healthcare where they would like shame you for not going into um, um, following, not, I mean, not advertise, not adhering. Like, I follow as an employee, I follow it, but like, sometimes my heart would be like, I really feel like I shouldn't get the vaccine, but I just go with the flow.
So I want to understand this for sure. Your concern isn't with vaccines. It's for vaccines brought to market relatively quickly, and like it's kind of like getting the iPhone and getting the software update. You don't want to be the first one to get the software update because there's usually some glitches with the new
Yes,
software. You want to wait a while, but unfortunately, if no one ever gets that first version of the new iPhone software, we don't know what glitches there are. So some
pretty much.
people are going to
Yeah,
have to get the vaccine,
pretty
but
much.
that's happening. That's happening in the trials, assuming they do it properly. When they leave the trials and goes to the public, it will have already gotten the glitches out, if they're, or not glitches, they'll make sure there's no glitches. But then again, if you've only vaccinated people in the trials within like a 6-month period, you don't know any possible long-term effects. Hopefully there's none, probably not any, but how do we know that for sure? There may be some longer term effects that we're just not understanding.
Yeah, yeah. I'm really like, I somehow, like, initially, if I wasn't in healthcare, I would rather, like, I could get a lot of like negativity on this one. Like, like, I rather would, like, because I know I'm healthy, I'd rather be exposed to the virus than like, than get the vaccine. But if the vaccine's been developed for like for 2 years, I would definitely just go with the vaccine rather than getting sick.
So that's a different way of looking at it. Now that I've had the virus, I would have preferred a vaccine and not go through that. I
Mhm.
think going through it, learn some things about myself. I can share my experience, and maybe that's helpful to others, because it seems like a lot more people are going to get this virus, especially in the United States. Like, the number of cases every day is it's going up like so crazy. The numbers are so high, that the virus it's not going to slow down quickly now. It's kind of out of control. So hopefully my message and our conversation helps some people know what's going on with them and they can be prepared for some of these symptoms that I had. But I would have preferred having had it, I would have preferred being one of the first in line for the vaccine when approved, as opposed to having that 2 weeks of.
It's that bad, hey? Like you'd rather just have the vaccine rather than
I'd
the
rather have that 2 weeks of my life back and not feel terrible and not feel kind of cruddy and not feel like the mental part of it. Yeah, I would rather be first in line for the vaccine.
what was the worst part of
I'll take some chances on that.
so like what's the worst, like what would be your, like the worst part that you can say that you don't want to experience again with COVID? Just to kind of like sell me the idea like COVID is really super bad. Like I know COVID kills, but like for people our age, I mean,
Okay.
like, you know.
Well, just simply, I would rather get a vaccine that I can have some level of confidence in rather than have diarrhea. I would rather have a vaccine than have the mental beatdown I had by not knowing when I'm getting better while spending all that time by myself and just feeling good and then feeling worse. I don't want that. I would rather just look the other way and close my eyes and let the nurse shoot me with a needle and hope that solves all my problems. I mean, that's what I trust with vaccines. The vaccine success rate, by the time it reaches me in the past, I feel very confident that the reward is much greater than the risk. And with the first run of the first COVID vaccine that's out there, I would feel maybe slightly less confident, but still very confident that the reward of not having to deal with getting the virus and going through all the symptoms and sicknesses is much greater than the risk of somehow the vaccine not being quite right and I deal with whatever side effects.
So maybe because like I've had surgeries before and I've made sure that I would have food for, like I came in with the, like when the pandemic started, and with my experience, I would be like, oh, when I had my wisdom teeth out, like I prepared like 2 weeks off. Like I already considered like what would happen, like if I had 2 weeks off, what would be my diet, and I prepared all the food that I can have. Like I prepared my my phone. I prepared my life for 2 weeks of being sick. I've had eye surgery and I prepared my Siri just so that it would know like what I needed. I prepared my friends or people that this is what I'm going to be needing from you guys. Like, so with COVID, I kind of like, I still have like a COVID stock of food, like just in case I do like knock on wood, like get COVID, like what would be that scenario? So I think I've psyched myself in a process wherein like if I do get COVID and it's like really shitty and like, oh, like diarrhea, like for 2 weeks, like I've got Gatorade and stuff like that. Like I've somehow prepared myself for that. And that's where we're like, okay, bring it on. Like, which is so bad, but like, you know, like somebody who's toughed it out before and have those kind of like, I've had flu before. And so I've got like ton of noodles and can of soup here just in case, and they're really salty. So if in case my sense of taste is gone, like or diminished, I can still taste food. So I've plus being a nurse, probably I know that I would be able to like put timers and turn myself, you know, like if I need to shower, cold shower. So yeah, maybe like my idea was like I'd rather have like the 2 weeks and then off and have that and cure myself, and then that's it. Like that's like versus this unknown vaccine.
versus the shot that's going to go in your body. And if it works right, you'll never have to think about it for months and you won't have to go through the miserable 2 weeks of using all these things you prepared for.
But that's the thing though. Like I don't get me wrong, I'm not opposed to virus. Like I'm not opposed to vaccine. It's that like I still have to get tighter, like just to know if my levels of immunity is still at that right, you know, and that's why I'm skeptical about the vaccine, like the early vaccine. I won't be skeptical about the, you know, the vaccines later.
So how many months after the vaccine comes out to the public would you feel like you would be comfortable getting it, having not heard any horror stories in so many weeks or months?
Probably like a year or two.
Really? Okay.
Like the typical virus, like a typical vaccine study. Like I would let that, and I would weigh pros and cons about that. Like in my life, I've always been like I'm being proactive for a 2-3 week being off. Like what would happen if that would be like a reality, and just what would like, just because of the experiences I had in the past. And so that's kind of like,
Dee, can we get to know a little bit more about you here?
Yeah, go ahead.
So you're registered nurse working bouncing around a few major cities in Alberta, as far as I understand, but you've got ties to different parts of different countries and different parts of the world. Who are you, and how did you end up being a nurse in Canada?
So I've had my nursing background in the Philippines, and my family, they moved to the States. And after finishing nursing, I took the Texas Board of Nursing. And so I'm licensed in Texas. And then a few years back, Canada was in a shortage of nurses, and they needed nurses from all over the world, and I happen to have like an American license. And so I got a really shiny brochure of how Canada looks like. It looks like Europe, and some of them speak apparently French. So I was one way to get away from my family, and I'd be like, okay, I'm gonna start living my life. So I signed up, and yeah, 16 years now here in Canada.
Okay.
So yeah, and I took the Canadian nursing exam, so I passed. So I'm an RN here in Canada. So yeah, that's like my story.
You think you will continue living there, or do you have aspirations for some new place, or going back to one of the places from your past and your history?
So the interesting part about my life is that I was in the Philippines, and I moved to different, like to States and Canada, and to Edmonton and Calgary. Like I've managed to somewhat live a life of, I won't be attached to my house or to my property. I wanted to be able to like live a life wherein, like if I feel like I wanted to go to Spain, or I wanted to go back to different places in Asia, I would do that. So yeah, I don't want to be tied down. I want to um, yeah, maybe potentially work in the States or Hawaii or South America, teach nursing there or something like that. So yeah.
And you mentioned, I think before we started recording, some family is in some Latin American countries too, or family history is?
No,
How does that tie in?
I'm Hispanic. My dad has Spanish background. That's why I speak Spanish. But and I wanted to explore living in South America. I've been in Central America, and but I wanted to explore Colombia as well. And yeah.
Still plenty of time, assuming that the pandemic ends and we can start traveling again. That's one of the things that connected us. I suppose the actual thing that connected us, I didn't have an Instagram account for, most of the years that most people seem to have one. And then I created one not too long after I had gone on a trip. I was in, where was I? Australia. I met one of your acquaintances or friends randomly, and then she and I connected eventually on Instagram. And then through that, and how these social media sites put new people in front of you that you might also want to connect with. You showed up, and I clicked on your profile, and then you ended up going to mine. I think, I don't know how we started talking precisely, but we have not yet met in person. But through our ambitions to travel, I imagine at some point we will.
Hopefully soon. I'm like hearing that you've had COVID. I was really shocked when you said like, "Oh, I'm recovering from COVID," or you were like a few days ago, and I was like, "Hey, how's it going?" And you're like, "You've had COVID." I was like, "What? You've had COVID? Like, tell me about it."
I tend to tell most people about it lately because I think it's interesting to people. And I also think there was a time not that long ago where most people still didn't know anyone that had it. That's definitely changing now with the cases going up. I think it'd be very difficult to be someone that doesn't know anybody that's had it now. I think it's probably still exists, but it's becoming less and less likely. So, but being that I've had it, and I have created a platform where I can tell people about it. I was happy to have on my previous episode one of my friends and kind of discuss that for the first time, and getting your perspective here with a nurse's perspective. And in Canada also, I think you're managing it a lot better, it seems like, than we are here in the States. Just to get your perspective on everything has been great.
We follow instructions here, I think, way better than our American friends. And I think it's a political climate too, that people are just pushing herd immunity there, whereas here we really would like vaccines coming soon, so just stay put, behave, listen.
Yeah, I don't know if the herd immunity, like, I get it. I know some people have thrown that word around. I don't think people are pushing it here. But I do think, as I think we talked about briefly earlier, is some people just expect to get it. You can't protect everyone from everything, and let's just go forward, which we'll find out. We'll find out how we do here really in the end.
A lot more of you guys compared to us. There's like 33 million Canadians versus what's your population?
About 10 times more than that, I think.
Exactly. So you're bound to have more cases than us. Like, that's just a fact.
Yeah. More cases, and especially in the urban areas where people are going to come in contact with more people. But at this point, it's reached everywhere. I don't think the population density matters as much anymore. Whereas previously it could have. You could have probably protected the people that don't live. If those people that live where population is less dense took precautions, they'd probably avoid getting it. But now I think it's too late. Too many city slickers going back to home, like I've done, and fortunately never brought it home with me. But it's too late to stop it now. It's on the loose.
Like a piece of advice to young people who still don't believe in COVID.
Well, I have a hard time thinking that there's many people left that still don't believe in it. And I don't know how, but not believing in a virus is just kind of nonsensical to me. But if you still don't think it's a thing, I think you need to reframe how you look at it, and not looking at it as and not that it ever was supposed to be some major disease that like wipes out hundreds of millions of people. Like, I think when we hear of the scary pandemics of the past, the ones that make the history books, the one that we really read about, they're just this horrific thing and everyone's dying. Well, maybe that happens sometimes, and maybe something like that'll happen again. Or maybe if we had the science and technology that we have now back then in the hospitals, that not that many people would end up dying anyhow. People would have gotten it and we'd have known how to care for them. But to me, it's not that different than those. It's just, it's going to hit a lot of people. We don't know what's going to happen. It hit me. I think I had a pretty moderate case. I would still avoid it. I would get a vaccine if I was anybody. I'm very happy to be done with it. But if you don't think it exists, one of these days soon, it's probably coming for you like it did me. And you never know. If you're around people and not taking it seriously 100% of the time, you're putting yourself at risk to get it eventually.
And I think too, like, you don't know, sometimes you could have like illness, like you have liver problems or lung problems that you didn't know of because you don't have any symptoms until you get tested. Like, like some people could have like kidney problems, and some kidney problems doesn't really show until your kidney has shut down to a very significant level, like 10%. Like that's when you'd be like, oh, my kidneys are effed up, And I think like like if you get the virus and you have a condition that you were not aware of, and I think that's going to be a wake-up call for people too, and be like, oh, apparently your liver is bad from drinking too much, and now the virus has affected it in a way, or you actually have a lump in your lungs, and now we've seen that the increase in fluid has caused the pneumonia to be severe, like those kind of things. And people are not aware of what's going on inside their bodies until they discover it. And so I think like if you do get the virus, I mean, like you could be healthy right now, and if you do get the virus and not knowing that you have a pre-existing condition, I think it's going to be really bad.
Yeah, it's the wrong way to learn that you have some underlying conditions that you didn't know were there. But I think that's
exactly
you hear the stories of the younger, healthier, seemingly healthy people that end up getting really sick or dying, that seems to be the case. There was something going on that they didn't know, and
Mhm,
COVID-19 seems
mhm.
to exacerbate whatever your vulnerabilities are.
Yeah. So I think that's where, like, when I talk to other people, I always tell them, like, you don't know what you have right now just because, your pre-existing condition. And once you get the virus, I mean, it's going to be a wake-up call for you.
Yeah, definitely. And like I said, it's spreading, and I think more and more people are going to go through this experience that I had. I would hope not everybody has to, and if we find ways around it, but I'm super unconfident in what's going to be happening here in the next couple months. It's just we're not. It's too loose. It's on the loose too much, at least in the United States, and I don't see enough changing to prevent it from flowing the way it's flowing, because we're going to be indoors and holidays, and enough people are still going to do these things and still be around people and think that everything's going to be fine, and just in enough cases it's not.
Mhm. I I totally agree. Like, this Christmas is going to be sad. Like, if like we're all in employment rate and mental health and lockdown, I think it's going to be really, really sad.
I don't have any optimism for what's going to happen, but I don't know. I don't know what to say about that. It's there's going to be unfortunately, and I hate to make this prediction, but more and more people are going to suddenly, for the first time, know somebody that's really sick with this or has died from this. And I think that's been one of the how do I express this? It's been one of the problems with this is, like, in this country, it's so big that so many people didn't know anyone that got it, didn't know anyone that got really sick from it, didn't know anyone that died from it. So it was easier to think that it wasn't real or wasn't a big deal. But just with the way the numbers are going kind of out of control, I just think this winter is when it's gonna happen, where most people are going to know someone that's gotten really sick or died from it. And that might finally get to people's perspectives to change, but it's too late at that point.
Would you think that social media is like doing a good job at letting people know about the virus?
No, because I think so much the voices of the people that don't really know that much about it and haven't known anyone that had it and want to
Mhm.
downplay it spread just as much as the voices of those that seem to know more. But what it does, and just today I looked, one of my acquaintances who's older, maybe not in the greatest health, I'm not sure, but he put that he had it, and this was the same person who just a few weeks ago also shared that one of his former coworkers had died from it. And weeks passed and he ends up getting it himself, and I fear that for someone like that and for other people of that age range and maybe health status, that
Y-
something bad could happen. I hope it doesn't. I don't know.
Do you know anyone who died from it?
No one personally. I think just I've known people that have talked about people they've known that have died from it, and I hope it stays that way. But I can't be confident that it's going to, because it just doesn't seem like we've done a good job here, and it's getting worse.
Yeah, I have a family friend. She's an elderly in Houston, died from it, and a close friend of mine in university actually died from it around our age. Like, he's 35, and
Wow.
he's like, yeah, he died, and it was like he did had in like it was my girlfriend who told me, like, hey Dee, like, do you know what happened to this guy? And I'm like, no, why, what's up? Like, and I checked out his Instagram page, and suddenly everyone was just like saying, like, to like, like, this is so sad, and all the comments. I was like, wow, wow, crazy. This is like such a healthy man, and he died of COVID, but I don't know what other pre-existing some like conditions he has. And yeah, that was like one time. That was I think it was in June that COVID hit me really bad, and like, the thought of it, like how young people can get the virus and die. So it was crazy.
So what? It's 5 months or so later. Has it really been weighing on you a lot since then, or have you been able to get into a different mind space where you're not as concerned with it for like for you or other younger people? But because I know you deal with older people usually, right?
Yeah, that with me though is that I am really worried to pass. Like if I do have it, I'm really worried how it would affect because I know it will kill old people and people with pre-existing conditions. Like, but for myself, I'm not worried. Like I'm not worried. Like if I work at a place like when at the early start of the pandemic, like some of the staff were just like calling in sick, and I wasn't afraid of it. I know how to gown up. I know how to use PPE. I know how to protect myself. I'm really confident with my experience and my expertise that I will be able to like prevent the virus from spreading if I was like wearing the proper PPE. And if I do get sick, like from unknown source, I know how to take care of myself. I'm more worried of like elderly, my family, and like yeah, I'm more worried about them than I am for myself. And that's always been my stand on things in life, is that I'm more worried about how it would affect other people because I can always like somehow manage. I've lived on my own for a long time and traveled a lot on my own. So I think I can, like I'm yeah, optimistic that way.
Yeah, I guess I always take that approach too, that I'll be okay. Who else? Who's a little bit less fortunate in some way or
Mhm.
at a greater risk that I need to pay attention to more? But yeah, for me, I never had a concern about getting it for my own long-term well-being. I just things usually go my way, and I come out of bad situations okay. So I think our approach is similar there, where our concern is outward for others, which is I think a healthy place to be, to have concern for others more than for ourselves all the time.
Mhm. Yeah, it's I've seen people die from it, and it looks really painful. And I work at a place, like I work at a hospital or at a long-term care where you see people succumb, and not only that, their families do. So, but then I've also seen old people recover from it, and the places I work don't have it. They don't have it. So we've managed to keep it away from our workplaces, and so yeah, I'm proud of that too.
Good. Dee, I wonder if we can move to the final segment that I like to have,
Yeah, for sure.
end of my podcast episodes. And today I'll have it be the personal growth segment. And maybe you can relate it to what's happened in the last year. Maybe there's something else totally unrelated to what we've just talked about. But I'm curious from you, when you think about personal growth and your personal growth, what is a story that you can share that you think might help some others when they hear you share it?
Mhm. I I think it's not being attached to anything, not being attached to. Um, I've tr- I've moved away from home, and I love my family, but I I don't put the attachment of like my identity is my family, my identity is my country, my identity is my home. Last year, because like last year I was thinking about like if I move somewhere else, like what's going to happen to my house? Like I've, who's gonna, like if I rent it out, like things like mm, I was doing the math exercise in my head, but I was just like, you know what, I don't want to be attached to anything. And the expectations that I put on things is that it's not as high as it was when I was younger, and now I've wanted to gamble more into happiness. And then like I'd rather try to explore things that makes me happy even though it's really scary, and jump on it and believe that my life has always been, if you just trust and somewhat prepare yourself with things that are surprise, like like unexpected things, and just expect the unexpected kind of attitude, but at the same time, like, you know what, life is beautiful. I'm just gonna follow that. I think that's what the past 2 years in my life has, like, coming out from a long relationship. My identity was attached to having someone in my life, having that perfect white picket fence family kind of thing. And now that I've detached myself from that ideal, um, I'm more open to possibilities now, and I like it. Like, I do have certain standards for myself, but at the same time, like, knowing that um, there's more out there to be explored, and if you just like run with the flow, you'd see more places, and you'd be able to reach heights that you've never experienced or imagined before. And experience has taught me that just go with the flow, and you'll be surprised where it'll take you. Just don't be attached.
So the more big attachments that you've had in your life have kept you from doing these things that you've maybe enjoyed more or explored more since detaching. And that's advice that you'd want other people to realize, that if you attach yourself to anything or too many things, that the possibilities are maybe more limited than if you had fewer attachments.
Yeah, isn't that what the Buddha said? Like, attachments is like the cause of pain or something.
Yeah.
Or someone said it, or Yoda, or whatever. Like, attachment is the source of pain.
Or maybe you just said it. Maybe who knows? But I do think that resonates with me. Like, that's the kind of life that I have been living, and I think I want to keep living. Just have fewer things and more adventures, basically, and allow unlimited possibilities for the future, rather than limiting that based on what I feel like I'm attached to.
And I see that on your page on Instagram too. Like, like, that's basically how we communicate. I mean, people might think that Instagram is really shallow, but I do believe that you can meet good people, and having a tribe, like our relationship of like positive people, and people who are like, if I'm scared of taking like making a decision in my life, I would go to people who I admire and admire you, and I'd be like, you know, like, help me think this through,
Mm-hmm.
or let me sort out my emotions. And that's my purpose in Instagram, is to actually find, because like, and I think it's worked way better now that everything's locked down. So now when you look at other people and you see a very interesting page, and you talk to that person, and you realize, like, yeah, this person really is going to be my tribe, and this person's going to be my, like, my friend. And I think that's what I really enjoy with us, is that even though we don't talk like as much as we used to, but at least like every time I connect with you, like, it's always been a good sounding board, and a good um, experience.
And I think the pandemic has allowed, at least for me, to connect with more people, new people online in different ways. That, yeah, you can, if you go, if you're paying attention to what you're looking for and who seems to have the same values, you can find people online that you can really connect with and make some new friends in the process. And
Mhm.
imagine maybe future travel partners or whatever. That,
Yeah.
like, that's for me, that's one thing I look for, is people that enjoy traveling, because I'm going to keep traveling once it seems like it's like international travel is a thing again. I'll be back out there going to somewhere new, and I like to know people that might enjoy that with me. And it seems like with your detachment observation, that makes that possible.
Because like, if you do have your friends who have a set of thinking, and you wanted to hear their feedback, or their thoughts about something, and then they would be like, no, don't travel, like, it's not safe for a girl to do that. And sorry, neighbor, so cute. I can throw a shoe at them.
And this house that you don't want to be attached to, it seems like the walls are very thin.
It's my friend's place, and she's at work right now.
Okay.
Like, you don't want to be attached to those kind of friends. You want to explore other people, and exploring. my Instagram is not about like numbers of how many friends I can have or popularity. It's about like who are the quality friends I want to keep in my life, and who are these people that I want to somehow travel and experience life with. And yeah.
Yeah, I think when you mention attachment, I wasn't so much thinking about the all sorts of different people that we might have in our life. And not that we need to detach from all of them, but it's really about continuing to detach somewhat, at least, from the people that don't really have the same vision for future with you, and then at least make some somewhat smaller attachments or connections, I like that word better, to other people that seem to see the world in a way that's similar, but also going to empower you to keep on growing and getting better.
I love that word, connections, actually, rather than attachment. I mean, I like to think that if ever I do meet that person that I want to spend life with, is that I am my own person and you are your own person, and we are connected, but we're not one. We don't end up to become like, you probably would end up like have the relationship, your dynamics would have a personality, but at the same time, I want to keep my personality, and you want to like, I want to develop, like I want to improve, help you improve, and you help me improve. But at the same time, I don't want to rely my growth and my just with one person. I want to be able to learn continually with other connections as well.
So to me, it sounds like the word attachment, but also the dependent part of attachments, where you can't be free to do the things that you want to do and grow in the ways you want to grow, because you are someone at home is dependent on you, or financially you're dependent to pay for something that's kind of holding you back from something else. So the attachment and dependent seem to be the words that really rise out of this portion of the conversation.
Well, there's always two sides of the coin, right? Like there's always like, how the Chinese would say crisis and opportunity is like the same word in Chinese. And so connection and I don't know, like there's probably a good side to connection or a good side to attachment and a bad side to attachment. But just avoiding maybe it's a poor word choice for me, and connection might be better, but I think just avoiding and knowing, being insightful that you don't want to go towards the negative side of being attached to someone or something or a particular idea. So
Takes constant evaluation and reevaluation, or maybe not quite constant, but very regular evaluating and reevaluating. That's what I think I do well. I say I think because I don't know how somebody else goes about it. And maybe they do it better in ways that I haven't quite realized yet. But I think regularly evaluating and reevaluating what I'm doing, how I'm doing it. Is it working? Does it make me happy? Does it bring me joy? Is it bringing me down? And gradually always minimizing the things that are hurting me and getting more of the things that are making me feel good, and continuing to move forward.
And I think having a good friend as well, like a good, honest friend who will tell you, like we've had discussions in the past before that we didn't agree on things, and somehow, at the end of the day, like what you've told me, like made me think and question my belief system. And even today, like what we're having right now is that it made me like think things through and be like, okay, I may not be able to agree with you today, but maybe 2 years down the road, I'm like, Kurt was right about the vaccine, or yeah, he was right about that approach, or something like that. But having a non-judgmental, honest type of friend is something that I really treasure, and if I can multiply like multiple of you, like I can find like similar people like you who I can have free, honest conversation, and I'll like, hey, my friend, this one, let's connect.
If you want to clone me, Dee, you can clone me. That's fine. There can be one of me in Canada. I think Canada needs one of me. I'd fit in with the Canadians. I like it up there.
I think you'd love it here too. So I'm really looking forward to seeing you here, and like, yeah.
Wonderful, Dee. Thanks for having this conversation with me.
Thank you. And get well soon. I hope you're like symptom free of whatever, like limp.
Thank you. I believe I am already, but if I'm not, I will be really soon.
Well, keep me posted. If you need a virtual nurse, I'm here.
Thank you.
Thank you.